And I'm thankful to each and every one of you viewing this, the residents and business community of the city of Springfield, for your patience and understanding as we continue to move forward to defeat this COVID-19. So that's not forgotten on me either. Thank you very, very much. The surge continues. Just as of note, I know I give you the weekend numbers, but Thursday we got hit with 87 confirmed COVID-19 cases. I mean, we haven't seen those numbers since May and June. Over the weekend, Friday was 30, Saturday was 45, Sunday was 43. Total confirmed COVID-19 cases since this ordeal has started back in early to mid-March, 4,202. The weekend total was 118, which was a little bit lower than past weekend totals, but we had that 87 on Thursday. Helen will elaborate more on that. Our senior food, meals distribution, deliveries, home deliveries continue to our seniors that are in need. Again, we're very appreciative of Governor Baker to stop the spread. Testing continues, and we're working very closely with AMR and Director of Operations Patrick Leonardo. One good thing, there were no new deaths again. So we stay status quo at 133. And again, to those who have lost loved ones, our thoughts and prayers and sympathy and encouragement go out to you and yours from myself and from the city. Of that, 57 who passed were white, 31 black who passed away, 43 Hispanic who passed away, 2 Asian. The percentage breakdown, white would be 43%, black would be 23.3%, Hispanic would be 32.3%, and Asian would be 1.5%. In turn, long-term care facility deaths stay status quo at 57, residential at 76. Please go out and vote if you haven't voted already. Tomorrow, our polls will be safe and sound. I want to give a big shout out to my election commissioner, Gladys Iola, and team. They did an outstanding job, especially with the early voting. Everything went pretty seamless here at City Hall and at the Claudio Concepcion Greenleaf Community Center. So thank you. But please, if you haven't voted, make sure you get out to your polling locations tomorrow. I'm sort of old school, so I will go to my polling location and vote tomorrow. Halloween went well. It was quiet, but I want to give a big shout out to Boo Bash we had, United Way, Paul Mina, and the United Way staff. They looked great, great costumes. We did that Saturday mid-morning behind the TD Bank. We had just endless rows of families and their vehicles coming there, and they were there with the Springfield Police Department. We were handing out candies and apples and other Halloween gifts, and it just went fantastic. So again, you can always count on the United Way and Paul Mina and crew. Great costumes too. Thank you so much for making it a happy day for our families and children. They really appreciate that. I also want to give a shout out to C3 Policing in Forest Park, the Springfield Police Department, with my brother and sister Elks, who did a great job at the Elks Lodge on Tiffany Street, and Attorney Neil Phillips and Gary Delisle and the rest of the neighborhood and business crew. They've just done a great job. That was a very strong participation there. Those cars didn't stop there either. And the costumes are fantastic. So a team approach. We wanted to make sure that our children and young people and families could celebrate Halloween in a safe, healthy way, and that did happen. It was updated last night, earlier this morning. Eversource does have their storm room open. You know, we did face some heavy winds, so it is operating in case there's any fallout on that. At noontime, we will once again raise the Puerto Rican flag, celebrating Puerto Rican Heritage Month, and I want to thank retired veteran Sergeant Gumasino Gomez, who always partners with the city to get this done. I appreciate his efforts. Schools, you're going to be getting updates from Superintendent Warwick and Facilities and Parks Director Pat Sullivan and Health Commissioner Helen Carlton Harris. We recently did, it was very long, a marathon meeting with the school committee last Thursday night, and we gave them an update with Bob Kirshner, our industrial hygienist, on what we are going to do to our buildings, when we are ready to go back into the buildings. And Pat also brought, what is it, the Star Wars thing there? R2-D2 is here too, a carrier system which he will demonstrate. That'll be going in, the MERV, HEPA filters, I-Waves, we're going to be doing that also. School sports, and I want to thank Commissioner Helen Carlton Harris, Superintendent Warwick, to try to get them resumed, but we have to do testing. And Pat Sullivan, I want to thank. So we're probably going to be testing about 600 student athletes before we consider going back. They will restart. They will speak to you on that. It wasn't sexy, but it was very important. The Water Shops dam, we've secured that through our resiliency grant, and that saves any type of negative activities of flooding occurring in that Maple High Six Corners all the way down to the south end, much the same we did with the Van Horn Dam to make sure we protected the flank of Bay State Medical Center in our north end area. I'd like each and every one of you to be cognizant out there. There are fraudulent unemployment claims going out, and that's right. Yours truly faced an unemployment claim, a layoff slip. I guess that you had to do it via election, but many of my staff also received fraudulent unemployment claims. I want to thank Millie Johnson, who's the director of my mayor's office, Consumer Affairs. She did a great job. So be cognizant of that. Just don't fluff that away. You have to check with your credit rating agencies, and you have to check with the unemployment office to make sure that it is filed that this is fraudulent. But that has been going on across the country, and a number of my staff also got hit. The Oasis Food Bank at Central High School continued even with the difficult weather Friday. I want to thank Pat Sullivan, my Chief of Staff Tom Ash, for coming through to make sure they had the equipment they needed to serve 3,500 families, which we do every Friday with vegetables, fruits, meats, foods, milk, and we work very closely, obviously, with John Foley, Oasis Food Bank in Food Bank of Western Massachusetts. So we appreciate that. On the police report, Deputy Bill Cochran will represent Commissioner Clapper today. She is attending another meeting that she has to be at. For myself, they're down 4 with COVID-19. Halloween, Deputy Cochran, Bill indicates, was quiet. It was very good, but they had a busy weekend. They took 10 firearms on 6 separate incidents off the streets. He will elaborate on that. We continue to prepare, working with our election division, with police, state police, Sheriff Kochi, National Guard, if needed. We always want to be prepared. We're hopeful that the elections go quietly and people exercise their right in a peaceful manner, but if needed, we are prepared. The Smith & Wesson shooting range, which is a very good investment to not only save officers' lives, but save other individuals' lives, and state-of-the-art. And we'll also have IIU and also other various departments will utilize that to bring revenue in. But that was very, very important. On the Springfield Fire Department, Commissioner Calvi indicates to me there's 2 down on COVID. They had a couple fires, Endicott Street and Elijah Street, but they're in good shape. DPW, Chris Signoli, 1 down, but he has 6 that are testing pertaining to COVID-19 right now. They are caught up with yard waste, so thank you very much on that. The call goes out for snowplow drivers again. Not only the city with the CDLs having difficulties, but many of the independents are having extreme difficulties getting drivers. So we want to make you aware of that, and again, we are looking for the independents again that we subcontract out with, and also CDL drivers. But across the Commonwealth, it's very difficult to find drivers right now. These companies can't find drivers, and we're going to continue to put a full court press because we want to make sure we have our plowing operation intact. Superintendent Warwick, again, we're nearing 4 million meals served to our children and families. It's 3,912,566. They gave out about over 94,208 meals over the weekend. Danny will go into the building update report with Helen Carlton Harris and Pat Sullivan, Bob Kirshner, John Kerrigan, who did a great job. What was very pleasing, I think Pat Sullivan probably indicated, or Dan Warwick, that Bob Kirshner, their firm, they handle many school systems across New England, Northeast, and he didn't know what he was going to walk into with an older type buildings, and he said he was very pleased. Springfield's well ahead of many other districts, so that's a testament, again, to Pat Sullivan and his team, so we're very happy on that. Danny, Superintendent Warwick, will elaborate that we will have a town hall meeting, I believe on November 10th, to explain to the public what we're going to do or not do pertaining to moving forward with our school system. We will have an official vote of the school committee Thursday, November 12th on that. Flu shots continue, iPads continue out with the pre-K. Superintendent Warwick updated me this morning, 20,000 laptops have been given out to our students, 20,000. So again, we're ahead of the curve on that. On facilities and parks, Director Sullivan indicates he's down 3 with COVID-19. He continues to review all our buildings, including besides schools or public buildings. He will do the carrier machine. He'll demonstrate to you that, what we're doing with our schools and other buildings. I mentioned the school testing of sports. We're awaiting what happens with the C Arena, depending on what the state does. Tentatively, we're looking at November 7th, but we don't know yet, pending with the state. Patrick Leonardo just gave you a shout out earlier, but thank you again for your continued efforts at AMR. Finances, as indicated, which I demanded, that MGM check will be coming in today for $2.3 million. Since this ordeal started, we've spent $10.7 million. 6.2, we've been able to, it's down to 6.2 on deficit spending and on grants. We've lost about $5.8 million in revenue since this started. I'm down about $800,000 for FY21. CAFO TJ Plan again indicates to me we're putting in our information for the second round of the CARES grant from the state grant. And if you translate it out, hotel, motel, meals taxes, if this continues, you're looking at $84.8 million in loss as far as spending going on. And as you know, we grab a percentage off that spending from hotel, motel, and meals taxes. Chief Development Officer Tim Sheehan indicates to me, again, we put that $2 million aside with Wayfinders to help out people with mortgages, rents, and utilities. That money is really burning up now. It's about $890,000, moving very quickly. We've helped out 311 families. We have to be cognizant that the eviction moratorium is done, so we're working behind the scenes pertaining to any foreclosures that might occur. Also, Director Sheehan will remind you, each and every one of our businesses out there, please, there is $50.8 million that Governor Baker has put out there in grants. That deadline is November 12th. And again, if you need any technical assistance, Tim will give you the information on how we can help you. The workforce training, which we mentioned a couple of weeks ago on technical aspects, I'm hopeful that that announcement will go out this week on how we're going to proceed. We're the homeless mental health unit to help out with our police department. and drug addiction. That is getting set up. We're hopeful that'll hit the streets very shortly with those subcontractors that we have to assist our police department and deal with some of those panhandlers too. City Solicitor Ed Pakula indicates to me, as usual, they're working very closely with Election Commissioner Gladys Oyola and with the DOJ and ACLU as we do on monitoring our election aspects. They're doing this across the country and across the Commonwealth, and we'll work in hand as we've done before. On that, Attorney Bill Mahoney, HR and Labor, indicates again Connecticut and Jersey have bounced Massachusetts off, that we can't travel there. If you do, you have to follow certain activities. With that, I'm going to bring up the hospital update. Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and then Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, and we're going to do what we've done in the past couple of months. As soon as they're done, so they can get back to their important duties at their respective medical establishments, they will take questions from the press. So without further ado, Dr. Mark Kerouac. Thank you.
Good morning again, everybody, and thank you, Mr. Mayor, for holding these events and giving us this opportunity, and thanks to the members of the media for carrying this information to the general public. Sadly, I have to tell you again that COVID-19 is continuing to increase across the world, across the country, across our state, and here in Western Mass. The United States has passed 9 million cases, and over the weekend nearly got to 100,000 cases in a single day. That's 2 times the rate of new cases that we were seeing back in the summer when it was surging down in the south. Deaths continue to hover between 750 and 1,000 a day. The state of Massachusetts has gone from 17 to 121 towns in the red. And I made one of my low-tech graphics to show that to you all. You don't really need to squint your eyes even from the back of the room to see that there's an awful lot more red on the bottom, which is the middle of October, compared to the top, which is the middle of September. It's not a pretty picture. If you look in the greater Springfield area, actually across Western Mass, there are about a dozen towns that are in the red, meaning that there are more than 8 cases per 100,000 residents averaged over the last, per day, averaged over the last 2 weeks. In addition to Springfield, there's Agawam, Chicopee, Holyoke, Westfield, to name just a few of them. Springfield, a few months ago, you'll recall, was in the green, quite an accomplishment for a large city, meaning it had fewer than 4 cases per day per 100,000 population. We're now approaching 16, 4 times that many. Hospitalizations and deaths statewide have doubled in the last 6 weeks. The test rates have also roughly doubled, more than doubled, between 2 and 4% positives to up to 5 to 7% positives per day on an individual basis. Bay State Health was at 8 patients a couple of months ago. A few weeks ago, we got up to 20. A couple weeks after that to 30. Over last weekend, over 40. We've come back down today to 38, with 32 in our Springfield campus and 6 in our community hospitals. I hope that's a trend, but we'll have to wait and see. There is no one in the ICU, and that's good, and it's related to the fact that we're dealing with a younger patient population, as well as having better treatments to keep people out of the ICU. We're testing up to 1,000 people today, and we have no issues with personal protective equipment. We could open up to 100 beds if we needed to without shutting down elective cases. We could open up to 300 beds if we needed to, if we discontinued elective cases as we did back in March and April. The president of Bay State Medical Center, Nancy Shendel-Fallick, who you've heard from at these meetings, continues to confer with the governor and Secretary Sutters of HHS, who chairs his COVID task force, 3 times a week on planning for surge on a regional basis. There are no signs of spread among our staff or patients at any of our hospitals. Therefore, it is safe to come for regular care, and don't put it off because other diseases are not taking a vacation just because COVID is spreading through the community. So you put all this together, and we are clearly in a second surge as a state. And sadly, it couldn't come at a worse time as people go back indoors and consider their holiday plans. About 10 days ago, I went down to the editorial board at the Springfield Republican and offered an opinion on how to have a safer holiday gathering. Not safe, perfectly safe, but safer. Based on the trends in the last few weeks, I would say it got riskier to do anything as a gathering beyond your immediate family, which is what I'm planning to do, a gathering of only 5. It's riskier to have a gathering in any red city, and that includes Springfield. And I understand people are going to make up their own minds about this sort of thing, but please consider the severe effects on elderly individuals and on people with chronic diseases, specifically obesity, diabetes, high blood pressure, heart and lung problems, or immune impairment. Even for healthy people with none of these issues, you should remember that this disease is not easy for people at low risk, and a small percentage of folks end up having chronic problems. If you are going to or hosting a holiday gathering in a red city or town or in some other high prevalence area, whether you're driving or flying, I'd recommend lying low 2 weeks before the trip and testing yourself a few days before traveling so you can get the result before. Here in Western Mass, we usually can turn around a test within a day, so I'd give yourself 2 or 3 days before. I am concerned that this may cause our governor to move us back as far as our reopening plans, which would have serious effects on kids in school and on many sectors of the economy. And it really doesn't need to happen if we follow the guidance that we've been talking about for many weeks. I would implore you to rededicate yourself to following the guidelines, masking, social distancing, hand washing. They're not a guarantee of safety, but they greatly lower your risk. If we can maintain this mindset of being careful in simple ways in public places, we can reduce the impact of this surge. And the commitment of each of us affects the health of all of us. Finally, I'm acutely aware that the virus is not going to occupy the headlines for the next few days. It will be the election. And I wanted to just say a word or two about that. Over 80% of Americans are following this election closely, which is much higher than previous years. And over 70% of voters on each side feel it would be a disaster if the other person got elected. At Bay State, we plan to keep politics out of the workforce and out of the workplace, which is how I'll be advising our leadership team today and tomorrow. We'd remind you that we are here for all people in our communities, no matter how you're voting or what your political inclinations are. We are, however, concerned that nerves might be frayed, and therefore we're preparing for inappropriate behaviors that sometimes come along with that. I continue to hope that the lessons this virus has been trying to teach us, our lessons will eventually heed. We said early on, and you've heard many people say we're all in this together. I think it's now time for our actions to start matching our rhetoric. This virus has been teaching us for a long time that we need to start acting more and more like a community and concerned with each other. And I hope that we can find a way to do that and step up in a way that is consistent, because that will get this under control even before we have definitive treatments like a vaccine. Thank you for your time today, and again, thanks, Mr. Mayor, for taking the time for offering this opportunity.
Thank you, Dr. Kerouac, very much. We'll now bring up Dr. Robert Roos, the Chief Medical Officer, Mercy Hospital, Trinity Healthcare.
Well, thank you, Mayor, for the opportunity to be here, and to your entire cabinet for the ongoing continued work and leadership and communication with our community, and also to the media for continuing to report out on this important issue week after week. Unfortunately, the news that I have to share is similar to what you just heard, that the state of the pandemic here in our community and across the country is not good. Despite each of us and all of our public health officials sounding the alarms for weeks on end, the second surge of infections and hospitalizations here is upon us. It's here in the city of Springfield and the surrounding communities. It's present throughout much of the Pioneer Valley with some exceptions. It's upon us in Boston and in Hartford where ICUs are filling up. And it's most certainly upon us throughout much of the country where viral transmission rages on. At Mercy Medical Center, we have seen the number of hospitalized patients more than double in just the past week. We went from about 3 to 6 patients on a given day hospitalized last week to 13 hospitalized today, one of which is in intensive care, and we'd seen our high this week as many as 15. We've also seen our test positivity rate be at 3% for 2 consecutive weeks, which is more than 3 times what it was just about a month ago. To put it into perspective, we have not cared for this many patients with COVID hospitalized at one time since the end of May. That's 5 months. And we have not seen this many positive tests week over week since the end of April. 6 months. We had 2 distinct periods where we had 0 hospitalized patients with COVID at Mercy, and unfortunately now we're seeing that reverse itself with pretty significant magnitude. And as we've heard, we are not alone. Across the entire state of Massachusetts, the number of hospitalized patients has doubled from the collective low point of 300 now to over 600, and there's been a rise of the test positivity rate to over 6% amongst individuals. There are more than 120 cities and towns in the red, as was mentioned, which represents a third of all the cities and towns across the Commonwealth. And with the exception of Berkshire County and Franklin County, you'll see that most of the state is dotted in red and yellow. Hampden County, over the past 2 weeks, has had the highest test positivity rate of any county, right at 3%. And Massachusetts has been added to the travel advisories of several of our nearby states, like New York and New Jersey. And actually, if we applied our own criteria to Massachusetts, we would be an affected state by our own rules, with an incidence rate of over 10 per 100,000 residents. We also know that the United States right now is setting the worst kinds of records at a very critical time in this pandemic, with record numbers of new infections daily at nearly 100,000, which has led to rising numbers of hospitalizations and deaths related to COVID. In this country, we've had over 9.2 million infections, over 230,000 COVID-related deaths, and there's been so many more people, countless numbers really, that have suffered effects related to COVID or indirectly because of the poor response to the pandemic nationwide. A recent analysis showed that COVID has led to over 2.5 million years of life lost in this country alone. It's impacted the health of older people as well as younger. The pandemic has resulted in massive unemployment, the shuttering of many businesses. And in some communities, hospitals and physician practices have had to make difficult decisions about whether or not they can even continue to operate with the massive losses and the shifts in how people are accessing care in the community. Across the globe, that concern has been magnified. There's been more than 46 million infections. Many countries now, including several notable European countries, are seeing rising rates of infections and hospitalizations and are facing a new round of lockdowns to preserve capacity in hospitals, like in England, and to ultimately save the lives of those that are vulnerable. So at this point, it is very hard to argue that we are not heading in that direction of more illness, more hospitalizations, potentially some more death, and perhaps some more eventual lockdowns or changes in mandates. However, I think that we can make a difference and we can prevent that. I personally don't think that we are there as of today. We're not yet at that point. But it's going to take each of us, each of you, to think differently and act differently from here on out in both our home lives and our external lives. In this week's Department of Public Health report, on page 38, there was an interesting chart that was focusing on the location of the active clusters of confirmed infections by the type of setting over the past 2 weeks. And it's exactly as we've been talking about and as we have predicted. The vast majority, 83% of confirmed infections, were related to a cluster that could be traced back to someone's household. There have been over 2,700 clusters with over 6,800 confirmed infections that were traced back to one's home in just the last 2 weeks alone. These are infections that are occurring amongst loved ones in a family. The second and third most common location of clusters of confirmed cases was in long-term care facilities and senior living facilities, with a total of 73 clusters, several magnitudes less, resulting in 663 infections, accounting for 8% additional confirmed cases. And so when you factor in together infections in the household and those in long-term care and senior living facilities, over 91% of those infections were occurring in the places in which people lived. And so, as it follows then, the report shows that while there are clusters and confirmed infections tied to other types of facilities like places of worship, restaurants, childcare facilities, schools, hospitals, they account for a small percentage, less than 10% of the infections. And I believe that's very, very clearly because businesses and activities have safety protocols in place. And by and large, people wear masks when they go out to shop or engage indoors in certain facilities. They by and large keep their distance when going into new places or they go to a restaurant. And there are limits on occupancy, and people spend smaller amounts of time in those facilities. But it's also clear that many people are not following those same guidelines with friends and families in their own circles, in their own personal lives, and they're bringing those infections home, whether they're aware of it or not, and then they're spreading it. And then those contacts go back out into the world, and it can create that vicious cycle. And so what's become clear as we look at the data, and we look at the data again, is that the battle against this pandemic really does start at home with our personal decisions and responsibility. And it will be won at home. But it has an impact that goes far beyond. A report by the CDC that came out this week actually showed just as much, that secondary transmission from one infected person in a household can result in infections in more than 50% of the other people in that household. And it can be spread very readily and easily amongst both children under the age of 12 and adults. The majority of infections here in Massachusetts are now occurring amongst young people. We've mentioned that a few weeks over, where the most number of infections are actually occurring under people the age of 20. The next is between 20 and 29, and then so on. It's important to recognize that those infections, even amongst the young, are not entirely benign or without risk. They do result, more often than not, in additional infections. They do lead to other cases that can contribute to severe illness, hospitalizations, or deaths. So I urge you all to think about this in the context of the past year. This has been a year of incredible challenge, of one of unspeakable tragedy early in the spring and much loss. We've also at times stretched the healthcare system so significantly that it led to other spillover effects where people delayed care. It's also led to significant economic challenges. And we're seeing this threat appear again in states across this country and in other countries. as we don't yet have a vaccine that's ready for deployment and we don't yet have a cure for this virus. We have, however, learned an incredible amount over the past 10 months. We know exactly what simple actions can help prevent the spread of this virus. Masking, distancing, staying home when we're sick, and getting tested if any exposure or symptoms. And so as we approach the winter, and we all think about these holiday gatherings where more people will spend time indoors with family or friends, I urge you to also think about ways that you can make a difference. Being in a household with someone does not make you immune from acquiring the virus if they have it, but rather it can actually make you sick and make other people vulnerable. Transmission can occur so rapidly amongst people even without symptoms that if you have somebody in your household or you know somebody close to you who's been exposed, who has tested positive, who has gotten tested and is awaiting those results, or is feeling sick with any of the symptoms that could relate to COVID, you must implore them to self-isolate, even in their own home, use their own bathroom, use their own bedroom, and for other people in that household to wear a mask until those results are back and that isolation period can be satisfied. The science is very clear about this. It's very clear about the risk of transmission. And it's really about masking, distancing, increasing opportunities for air exchange if you're sitting in the same room, and reducing the time that you spend together. Each time that you're with other people, I urge you to think about how you can reduce your risk through one of those actions. And over the holiday season, I encourage you to make a personal commitment to do what you can, to practice the efforts like masking until it becomes habit, to keep the supplies handy, and to think about the people in your life and those in our community that would be at risk or vulnerable, not only to illness, but also to the economic changes that will occur if we continue to see rising rates of infections. Otherwise, I unfortunately predict that we may be confronting a time in which there will be more mandates that are to come to protect the health and safety of everyone. I cannot stress enough that to the people in the community that you are actually the front lines in this pandemic. You are, each of you, the public health soldiers that can help reduce transmission through your own actions. We at the hospitals, we are the last lines of defense. We are there, we are the troops that will care for you when you need it. At Mercy, we are ready, we are prepared, we have the PPE, we have the testing, we have the protocols. We're prepared to maintain all types of care throughout rising rates of COVID so that you do not need to avoid or delay any types of care. And we are committed to your safety. So please, please take your personal efforts seriously. Help support those around you to do the same, because many people's lives and livelihoods depend on it. Thank you.
Thank you, Dr. Roos. We'll now have Dr. Kerouac and Dr. Roos take any questions or comments from the media, please. Any questions or comments? Paul?
What do you think about the idea of, I guess it's been referred to as serial testing, where a lot of people would be required in testing, restaurant workers, other, besides just the frontline workers who are getting tested now. What are your thoughts about that?
Yes, I think rapid, frequent testing with rapid turnaround has been the key to success for many other countries, Taiwan and South Korea, for example. Here in this country, we have been limited by reagents. We would love to be able to test 3,000 a day, but we have to be scrounging and begging every day to have enough chemicals to do those tests. If indeed you were able to test frequently, as let's say some colleges and universities do, you could even settle for a lower sensitivity test because the effect on the crowd would be to suppress transmission. So I think it is a smart part of a strategy, not the whole strategy. We know from the White House that that didn't work as the only strategy, but it can be a smart part of a comprehensive strategy. And I wish we had more in the way of materials to make that happen.
Dr. Roos?
I just would reinforce that point. I think it's incredibly important. We've seen that actually with the schools and universities, representing a very low percentage of the numbers of infections, very, very few clusters of infections that have resulted in further spread. And that, short of all the recommendations that I mentioned in terms of masking and isolating in one's own household, that would be another opportunity to intervene in that within households and amongst close family members if there was more wide-scale, rapid, accurate testing available.
Any other questions or comments?
Doctors, obviously we're seeing what's happening in Europe, and some of these are countries that we kind of assume we're doing everything right, so to speak. Do you have any insight into what there might be some difference here that might be able to allow us to avoid what seems to be the fate of at least another round of lockdown? Maybe not as long as the last one, but still some kind of lockdown, because we generally wouldn't associate what was going on over here with anything positive that might let us avoid what they're going for.
Yes, I think that the flavors of lockdown have been very different in the different European countries. Germany, I believe, is looking at restaurants and bars, retail establishments. France has imposed a curfew. No one, I believe, has done the sort of lockdown that's been seen, for example, in China or in Italy back in January and February. So I think that what they're trying to do is to get their arms around areas of activity. As Dr. Roos mentioned, you really need to we're a little smarter now about where the infections are coming from. And to me, it's never made a lot of sense to close down sectors of the economy or sectors of social activity where infections aren't spreading. And that would include restaurants, retail, schools, churches, etc. It certainly could get to the point where infections are so widespread that you can't tell where they're coming from. And in those instances, I think that would be a time where conversations about that sort of thing would be happening.
Do you think that, given the fact that we are seeing so much of this spread happening within households and probably to a certain extent social gatherings that are informal as well, and any like the patient zero was one of those, so that itself doesn't qualify as a cluster. I mean, is there even any reason to believe that some of these, if we did end up shutting down various businesses, that it could even stem the spread? I mean, is there a concern that if we do
it might even make it worse, right? Might even make it worse if you were to shut down restaurants. People might decide to have more home parties.
Any other questions or comments? Dr. Roos? Yes, Mike, go ahead.
I'd like to know if the hospitals are prepared for the flu season and how that relates with the increase in the COVID cases.
So yeah, we've been continuing to talk and focus efforts to ensure that we're prepared for both influenza season as well as rising rates of COVID. At Mercy Medical Center, we've done a few new things this year in regards to making sure we're well prepared for flu. Much of that is the same policies and protocols that we're doing to prevent COVID infections, with masking and temperature checks at the front entrance and separating patients in our outpatient areas to those with fever and upper respiratory illnesses from those who are well going for other types of care. In addition, we mandated influenza vaccine for all of our colleagues, except for those that have a medical or religious exemption. And we have developed testing protocols so that we can better utilize resources for those that would need testing for influenza and COVID or one of the other based on their clinical symptoms, their exposure, and maybe the history of whether or not they've had COVID before or not. So we've increased our capacity to test as well. So at this point, we are well prepared for influenza season and for the rising rates of COVID. But certainly it's always something that we are mindful of as they can create additional complexity for the individual.
Thank you, Dr. Roos. Dr. Caraway?
We're observing the same approaches, so I would agree with what Dr. Roos said. The only thing I would add is that all of these great things we've been talking about that help prevent COVID also help prevent flu as well, because it's transmitted in the same way.
Any other questions or comments? Okay, hearing none, again, I
Thank you,
want to
Mayor.
thank Dr.
Thanks a lot, Mr.
Caraway,
Mayor.
Dr. Roos. Thank you, and good health to
Thank
you
you
and
all.
your families and your staff. Thank you. We're now going to bring up our Dr. Anthony Fauci, and Commissioner Helen Carlton Harris, who's done a tremendous job. And don't worry, if they fire Dr. Fauci, you'll still be calling the shots here, Helen.
They're not going to fire him.
Well, they shouldn't fire
They're
him.
not fire Dr. Fauci.
That's right. You need Vanna White here or
I
no?
had my Vanna, but he has left me. Thank you, Bill. I just want you to turn this one over for me. Thank you, sir. I appreciate you. Thank you, Mayor. You are always willing to jump in no matter what. I appreciate it, even if it's turning the charts. Good morning. So the numbers are very, very clear. Statewide, there are 155,660 positive cases. The deaths on the state level are 9,788. Here in Hampden County, there have been 10,359 positive cases. The deaths are 821. In Springfield, our cases are 4,202, and the deaths are 133. Since March 9th, for 35 weeks, the City of Springfield has stood before you every Monday and attempted to give you the necessary information to make good decisions. I am going to begin with our charts to my left. The first chart shows you the number of cases in the City of Springfield over the past week. And as the mayor indicated, on Thursday we had 87 cases, which we have not seen since April or May of 2020. Monday, 36, Tuesday, 41, Wednesday, 31, 87 on Thursday, Friday, 30, 45 Saturday, and 43 this Sunday. We want to look at the cases by month because that is important to understand where we were and now where we are. In March, when we began this pandemic, the City of Springfield reported 54 cases. In April, that went up to 1,069 cases. In May, we had 1,300 cases. Then in June, we began to get this virus under control. We had 289 cases. July, 328 cases. And then August was our lowest case count of 182. September, 318 cases. And then in October, we are seeing the highest number of cases at 867, the highest cases that we have seen since April and May. We want to look at the cases by age. The cases by age, under the age of 10, there were 26 cases this week. 11 to 20, 74 cases. 21 to 30, 62 cases. 31 to 40, 60 cases. 41 to 50, 28 cases. And 51 to 60, 30 cases. 61 to 70, 22 cases. And 71 to 80, 10 cases. And 81 to 90, 1 case. Let's take a comparative look at where we were last week and where we are this week. Every day last week, our cases exceeded the previous week, with the exception of Friday, where we had 51 cases, and this Friday there were 30 cases. Every other day has exceeded the cases that we have had in the prior week. And of course, the one that stands out to each of us is that 87 cases that we had on Thursday. Let's look at the cases by percentage of age. 52% of the individuals who tested positive last week were 30 years or under. In the 31 to 50-year-old age category, that was 28%, and then 51 and older was 20% of the cases from last week. We want to look at zip codes. Zip codes, you can see at the zip codes where we're seeing the highest cases. 01104, 62 cases. 01108, 46 cases. 01109, 66 cases. However, those areas of the city where I told you the cases were low, we are now seeing an uptick in those zip codes as well. 01118, 23 cases. 01119, 19 cases. 01129, 14 cases. And 01151 had 13 cases. If we look at these numbers by percentage, you see that 01104 was 20% of our cases, 01107, 11% of our cases, 01109 was 21% of our cases, and 01108, 15% of our cases. As you can see, again, we're seeing in every zip code in the city of Springfield, cases are going up. Take a short look at race in our city. When you look at the form that asks for race, what it says is Asian, Black, White, American, Indian, and Native, and Pacific Islanders, and unknown. And so when you look at the race, it does not allow us by our forms to pull out under race Latinx or Hispanic. But when I researched the data, that other category is Latinx, that 33% that you're seeing in green. It does show up under ethnicity where it says Hispanic, non-Latino, or non-Latino Hispanic. They are under that category where it says ethnicity, but not captured under the race category. And so we have to do some digging in order to come up with that data. But that 33% should say Latinx. And so the trends, the number of persons under the age of 50 now make up 80% of our cases in the city of Springfield. October is now the highest month of record positive cases since April and May of 2020. The number of cases in institutions of higher learning are increasing, and one institution has made the very difficult decision to go remote. You have heard, and it is true, household transmissions continue to be the primary source of infection. Small and large gatherings continue to be another primary source of infection. 32% of the individuals who had a positive case last week were under the age of 20. 40% were between the ages of 21 and 40, and so that makes 72% under the age of 40. We have had an uptick in cases, as I talked about, across the city of Springfield, but 55% of our cases are in 01104 zip code, 01108, and 01109. So what have we done over the past week? Our outreach has continued to neighborhood councils and civic associations. I have heard from groups that they need assistance with information, with face coverings, and being able to have educational materials. We are in the process of printing 5,000 additional flyers so that we can give them to the neighborhood councils, civic associations, and community-based organizations who request them. They are in a multiple language. We will hand out and have our educational materials at the libraries for their curbside events, and we are going to make sure that we are handing out materials as we hand out our lunches at our senior center and Springfield public schools. On November 10th, the Department of Elder Affairs will have a drive-through Thanksgiving, we believe, and we will have information and individuals there to give information to our seniors about how to keep themselves safe. We have held another task force meeting to discuss COVID-19, flu, and cold weather. We appreciate all members of our community who have participated with the Springfield Department of Health and Human Services in this effort. The City of Springfield Public Schools, Springfield Department of Health and Human Services, Springfield Department of Parks Facilities, in conjunction with Fallon, you have heard, will conduct a stop-the-spread testing site at Central High School on Tuesday and Thursday of this week. The primary purpose is to test the over 600 student athletes, those who are actively competing and those who are practicing, and cheerleaders will be tested. We also have asked Fallon if a family member is with their student athlete to test them as well, and because it is a stop-the-spread site, that will happen. I want to personally thank the mayor, the superintendent, Mr. Dan Warwick, the assistant superintendent, Liddy Martinez, nursing supervisor, Jeannie Clancy, and Ann Mistabar from our office, and Dwayne Early, the athletic director, and Patrick Sullivan from Facilities and Parks for cooperating. There is one thing that is amazing to me about the City of Springfield and our partnership as a cabinet. When a need arises, we collapse around that need and we get it done. And I very much appreciate the fact that we will be able to test all of the student athletes, and we will get that done. We continue to monitor businesses, restaurants to enforce the face covering mandate. And as the doctor said, that is not where we're finding the primary source of infection. I have had the opportunity to spend Saturday in many box stores, in many convenience stores, going from place to place just to observe. And I can tell you that people in our stores are, for the most part, taking this very seriously and adhering to the mask mandate. You must remember that the mayor and the Department of Health and Human Services put a regulation in place to mandate face coverings. That was done May 6th. That mandate or legislative mandate is still in place. And so we want to make sure that you understand, as the public, you should wear your face covering in any place that is open to the public, or if you're indoors and someone comes in your environment who is not a part of your family, who is visiting, and you may want to consider wearing face coverings even when you are around your family members. Remember that this virus is spreading indoors amongst families in small gatherings. And so face coverings are mandated. Waiting in line to go in a store, shopping in a store, waiting or riding on public transportation, riding in a taxi or other ride service vehicles, seeking health care, going to essential businesses, and when working or performing jobs that interact with the public. Entering or exiting restaurants, face coverings are not required at home because we can't be in your home every day. But, as I said, if you have individuals coming into your environment who are not a part of your household, who you are not around regularly, you should immediately put a face covering on. When someone comes in your house to check something, for example, I had to have my furnace cleaned. I took the gentleman's temperature, I made sure he had on a face covering, and I stayed 6 feet away from him. That's the kind of behavior we have to have when individuals come into our environment for any reason at all. Enforcement. Law enforcement and public health officials are empowered to enforce the regulation and individuals can be fined up to $300 per occurrence. Springfield Police Department sworn officers are designated as agents of the Board of Health for the purpose of enforcing this regulation. It is pursuant to Mass General Laws, Chapter 111, Section 30. Travel orders, the only states you can come to from to the Commonwealth without testing and without quarantine for 14 days are California, the District of Columbia, Hawaii, Maine, New Hampshire, New York, Vermont, and Washington State. New Jersey and Connecticut have been eliminated from the Massachusetts mandate, and we have eliminated Connecticut and New Jersey from the Massachusetts mandate, and Connecticut and New Jersey, have removed Massachusetts from their mandate. So that means, from being exempt, so that means if you travel to Connecticut and if you travel to New Jersey, you will need either to be tested or be quarantined for 14 days and vice versa. Collaboration with the state. Want to thank all of you who got the alert last Monday. It seemed to work because Patrick Leonardo tells me that the people were waiting in line for up to 3 or 4 hours patiently to get tested. So you all went out and took that seriously and got tested, and we appreciate that, and we appreciate AMR, who has overall tested 29,361 individuals. 12,064 of them were Springfield residents, and Springfield residents showed a 1,209 were positive. We will have the neighborhood ambassadors that will be working with us from the Commonwealth, and we will have PSAs going out, as well as having them on buses and other places where they can be observed in multiple languages. We all have a role. The federal government has a role. We would hope that at some point we could have a mandate or at least a recommendation that everyone wear a mask and everyone be tested. The state government has a role, the neighborhood ambassadors, the PSAs, our partnership with them. We are appreciative of Governor Polito as well as Governor Baker as well as Lieutenant Governor Polito. Local officials, we and elected officials have a role. We have continued to ask, wherever you are in your environment, please make sure you are following the recommendations of public health. And you and I have a role to thwart this community spread. We've talked about it over and over again. Personal responsibility. That personal responsibility has been expressed by both Dr. Kerouac and Dr. Roos. Make sure, this is an individual decision. You have the power to put on a mask. You have the power to wash your hands. You have the power to socially distance. This is something that you can do. And we can't be with you as government officials all the time. Your family can't be with you all the time. So we are asking individuals, please make very, very smart decisions. You can do this. As I've said, we have been doing these press conferences for 35 weeks since March 9th. We will do them, the mayor tells me, for another 35 weeks if necessary, because our goal is to get information out to you. The mayor says we hope not, and we all hope not, but I want to emphasize our commitment is not to stand here every week, and our commitment is to do 3 things: educate, legislate, and advocate. We educate you by standing here and giving you information. We have legislation in place all over, like the face covering mandate, like the legislation that has to do with businesses, like the mandates that we put in place because we want to protect you. That's legislation. Our goal is to advocate for you, and we do that as a municipality on every level. We make sure that we're getting our fair share, that individuals do have access to our PSAs, have access to PPE, are able to stay strong in the face of what has become something that all of us have become very tired of. We may be tired, we may have COVID fatigue, but the virus is not tired. The virus is not tired. It loves having a host. We are the host. And unless we do the things, wash your hands, 20 seconds or more, watch your distance, 6 feet or more, wear a mask or a face covering. Unless we do those things, and I know I have heard from people who say to me, we're tired. Every day someone tells us these things to do, and I ask them, are you doing them? That then becomes the real conversation. Are you heeding the public health non-pharmaceutical interventions that we are asking of you? We do hope so. We will stand here potentially next Monday. Hopefully our data will be better. Hopefully the information we share with you will be better. We know we're heading into the wind. We're heading into the holidays. We turn the clocks back. It's darker earlier. We're going inside earlier. There's so many things that we're facing futuristically that is going to require us to step up our game and be as vigilant and do the mitigation things we've asked you to do. I appreciate the time that the residents take to listen to us, and we just hope that you follow our recommendations. Thank you.
Thank you, Commissioner. Thank you, Helen. Thank you, Commissioner Carlton-Harris. We'll now go into the public safety segment of the update, and I'll start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. As the Mayor stated, we have 2 people out awaiting testing for COVID-related symptoms. The 2 people out last week tested negative and are back to work now, so everything is good on that front. We did have a couple fires over the weekend, one on Friday afternoon and then one actually this morning at 1:30 a.m. No injuries were reported at either of those fires. Everyone's in good shape. Everybody put in a good effort to get those extinguished quickly and without any injuries. I do have a warning for everybody today. The wind is going to be blowing at 45 to 50 out there, so if you're out walking around, be careful of falling tree limbs and anything that might come down, and that's all I have for this week. Thank you very much.
Thank you, Commissioner Calvi. Now representing Commissioner Cheryl Clapper is Deputy Chief Bill Cochran, Springfield Police Department.
Good morning. Thank you, Mayor. Over the weekend was relatively quiet. The Halloween activities on Saturday were good, quiet, no real issues. But we did have, like the Mayor told you earlier, we had 10 firearms recovered over on 6 separate incidents this weekend. I'll go over them briefly. On Saturday at 2:15 in the morning, officers went to Fenwick Street to check on a man who was reported sleeping in the car. When they checked him for his safety, they found a gun in his pocket, and illegal gun in his possession, and he was placed under arrest. At 2:30 in the morning, 15 minutes later, officers went to the 82 Pearl Street for the report of an assault in the basement there. A woman got beat and hit with a firearm, and the firearm was recovered at the scene. Sunday morning at 12:50 in the morning, narcotics officers conducted a traffic stop on Alderman Street. They recovered a loaded stolen firearm, and the subject that was arrested had been previously arrested for illegal firearms convictions. At 2 a.m. on Sunday, we recovered 3 firearms and another traffic stop. There was a ShotSpotter activation on Washburn Street. Officers conducted a traffic stop there with 3 individuals in the car, and each individual had a firearm in his possession. On Sunday, I think the Mayor talked about there was 6 cars taken out of Water Shops Pond. Well, it was six cars and 1 firearm. So they found a firearm in the water over there. We believe it was from an incident last fall where we chased some people over in that area and a firearm was involved. And finally, there was Sunday evening at 10 p.m. Officers went to Middlesex Street for a home invasion where 3 men broke into the home and beat the victim. When officers arrived, 3 men were placed under arrest, and drugs, cash, a large amount of illegal cocaine was seized along with 3 firearms. Briefly, those are the 6 incidences that we dealt with over the weekend. For tomorrow, the department does have a plan for Election Day coverage. Each polling place has an officer assigned. The Election Commission hires an officer for each polling place. And the police commissioner has put out some extra patrols, safety patrols, high visibility patrols on the day shift and the evening shift. Like the mayor said, the Mass State Police has 50 troopers on standby, available to us if needed for Western Mass, and the National Guard has about 100 National Guardsmen on standby as well. And we'd like to thank Sheriff Kochi for tomorrow. He'll be taking any of our arrestees to his Ludlow facility because he has a rapid COVID testing there, so we can make sure that our officers aren't exposed immediately. And that's it. Thanks, Mayor.
Thank you, Chief Cochran. We'll now get an update from our schools. Superintendent of Springfield Public Schools, Daniel Warwick.
Thank you, Mayor. Good morning, everyone. As the mayor said earlier, our meals program has been going very well since we closed down in March. And again, this is for a city with a great deal of food insecurity. We've distributed 3,912,566 meals, and this weekend alone, 94,208. So congratulations to Sodexo, our partner, and Patrick Roach and the team from our lunch department that have done an absolutely fabulous job. And again, when you think of it, we're going to go over 4 million meals this week. We had a great report to school committee from O'Reilly, Talbot, Noken, Bob Kirscher on our buildings. And, after looking at the analysis and going over it with Patrick Sullivan and Helen, it's incredible for the age of our buildings when you look at similar school systems, and Bob pointed this out to us because he works all over New England, the great shape that our buildings are actually in. And again, we don't have any air quality problems. This is about improving ventilation. Pat will go over it later, but the mayor has stepped forward and said that he's going to put the money into providing these carrier units, again, under the city budget, so that won't inhibit our ability to provide services to our kids, but so that our air quality will be up and will actually meet the Ashrae, a higher level of standard than other schools in the Commonwealth. We're the only ones shooting for this Ashrae standard. So grateful. Again, I think Helen said it earlier so well, that our city comes together. And, we come together around what's important to us. And what's very important is our most prized possession, our kids. We're going to have a vote on reopening schools at the November 12th school committee meeting. And before that vote, we're going to have a town hall meeting on November 10th. We had a very, very successful town hall type meeting back in August when we made our decisions on opening. We're going to have a similar event. The participation was great, and everything was done in multiple languages that reflect our community. Working with Helen and her department, we're also providing flu shots at several of our schools, and that's still going on because that's going to be very, very important for us as we reopen. Again, working very closely with Helen and her department, we're going to be able to do a sports restart, but with appropriate testing for our 600 athletes. So we're going to do that testing outside Central High School this week, Tuesday and Thursday, and we're going to have more information. But all of our student athletes will be tested so that we know we can restart safely. Again, we've invested heavily in technology. The mayor talked about the laptops. Now we're distributing iPads to all of our preschool students, so working on that. And again, any family who can't go to the school to get an iPad, we're using our transportation company, again, with the mayor's support. So we'll actually deliver those iPads to those families. We have a helpline that we put in place over a month ago that's taking a lot of calls and helping us deal with all of our technology issues. And we had a significant ransomware attack. We briefed you on some time ago. We're in the recovery mode from that attack. And again, our priority was our systems for our students, and all of those systems have been up and running with a minimal interruption. Thank you, Mayor.
Thank you, Superintendent Warwick. We're going to piggyback. I'm going to bring up Pat Sullivan, Facilities and Parks, so you can piggyback off, especially the school buildings. The Director of Parks and Facilities, Patrick Sullivan.
Thank you, Mayor. Springfield made a critical decision this past summer after reviewing the DESI standards that were provided to our superintendent of schools. After conferring with Helen Carlton Harris and our industrial hygienist, we met with Dan and Mayor Sarno, and it was decided to raise the bar for the city of Springfield and follow the Ashrae Standards. And Ashrae stands for the American Society of Heating, Refrigeration, and Engineers. They had issued an epidemic task force document on July 7th, 2020, and Springfield chose their document over the DESI document. In that assessment that was provided, we found that 51 of our Springfield school buildings meet the Ashrae guidelines for school ventilation per this document. And I have to credit Mayor Sarno. He has invested over $40 million in the Springfield school systems and the heating and ventilation systems, and that investment has prepared us to deal with this epidemic. 4 school buildings require additional ventilation, and that was no surprise. They are Brightwood, Homer, Kensington, and Springfield Day Middle. These are our oldest school buildings in the system. So what the city will be doing to ensure that we meet the Ashrae standards in those buildings is to purchase this carrier unit. It's an air scrubber machine. It works very efficiently. What it does is takes air from the bottom of the unit, and it passes through a series of filters, and that filter rating is over a MERV 20. Right now they are recommending a MERV 13 filter in fighting this virus. And then it brings the air back up to the top of the unit. We will be modifying the unit with a diffuser, and the unit will be very quiet. But each classroom in those school buildings will have it. Any room that's used in a basement will use it. And I have to again credit the mayor. Called me Friday morning after the presentation Thursday. He wants to extend these units to our fire stations, police department buildings, municipal buildings, any building that we have people meeting or congregating. He wants these units. So, Mayor, we have calculated those numbers and we'll work with finance. The other technology that we are going to purchase is the iWave technology. And basically, it's just barely 4x6. It's a little black box. It gets installed into the ductwork system of the building. And what this air purifying device does, it uses it's called needle point bipolar ionization to create equal amounts of positive and negative ions. So what that does is it takes the hydrogen molecule out of the virus or the mold that is passing through that system, and basically it ensures that virus or mold or pathogen will die. And then it also helps it attract the remaining particles to the filtration system. So these units, again, per the mayor's directive, will not only be installed in the school systems, but also in any municipal, fire, public safety building that can accept that technology. So, Mayor, I just want to thank you enough for all your support, and the city will be spending over $1 million for this technology. But again, I think the city of Springfield, we want the best. When Helen and I set these tents up on Worthington Street, we used the iWave technology. I would like to think that is probably the reason why that they treated over 30 people that were positive, and none of it was transmitted to the staff that were working on that. So we, as a group, we treat every building and everything that we do as if our own personal family is going to be involved. So again, I appreciate all of my fellow cabinet members for their support.
Thank you, Thank you, Director Sullivan and your team. John Kerrigan have been absolutely fantastic, and I'm glad we've been able to make the investment of really well over $600 million when it comes to our new and rehabbed schools that we've built on it. But the HVAC, again, with Bob Kirshner, the industrial hygienist, he was pleasantly surprised because he does not see this in other systems around. So this is if and when, and again, Superintendent Warwick will continue to consult with Commissioner Helen Carlton-Harris, Patrick Sullivan, if and when how we decide to move forward for the second marking period. But we do want to be prepared, and when it does come time to get our kids back into school, that they'll be safe and sound. But we look forward to having that town hall meeting November 10th, and then we'll have the official vote on how we will continue to proceed educating our children on the school committee meeting of November 12th. With that, I'm going to bring up DPW Director Chris Signoli, and he will give you a brief update pertaining to the Department of Public Works. And I appreciate those young men and women of DPW. They've been out there day in and day out, and I appreciate that. DPW Director Chris Signoli.
Mayor, thank you. As mentioned before, the DPW has one employee out due to COVID. However, we have 6 other employees that are out that will be testing over the next couple of days. We are caught up on yard waste from last week. I would expect by the end of this week, we will probably be at least a day behind. This week and the next 2 will be heavy, very heavy in the city of Springfield. Commissioner Calvi and Deputy Commissioner Cochran were talking about the drawdown at Water Shops Pond. It drew a lot of people out there. Be extremely careful. There's a lot of areas out there that are not stable. And if you do find anything out there of concern, contact the police department. There were a couple postings on Facebook of people showing, I found a gun. So they posted it on Facebook with, with that picture. So it's probably not a very smart thing to do. So please be careful if you're out there. Snowplow contractors, as the mayor talked about, we are having an extremely difficult time this year having contractors apply for the contract for this year. They are having a difficult time finding drivers, CDL drivers. The Department of Public Works has openings within its department for CDL drivers that we are having an extremely difficult time finding. So, excuse me, if you know or if you are available, have a CDL, and are interested in plowing for the city of Springfield, we have increased the rates significantly for this year. We also have an incentive that if you sign up by, I believe it's November 25th, there's an extra rate that goes on your hourly rate. So I would encourage people who are interested in doing that to sign up for snowplow contracting for the city of Springfield. That is it. Thank you, Mayor.
Thank you. Thank you, Director Signoli. And again, this is just to give fair warning. We always look to do 100%, 110% when it comes to our plowing, but this COVID-19 has affected the work pool of drivers, has affected people being able to take CDL licensing aspect on it. So we're going to continue to be aggressive, but there are opportunities with Springfield DPW, and also the independent subcontractors out there are having a very, very difficult time getting CDL drivers, because we want to get up to our full complement besides city side, the independents out there. So again, if you're CDL, we're looking for you, and as Uncle Sam says, we want you. And also I know many independents are looking for drivers so we can be prepared to, when it comes time to move the snow. With that, again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan, the team have done a great job as far as trying to stabilize our businesses and help them hang on. So when we rebound on this, we rebound quickly. So Chief Development Officer Tim Sheehan will give you an update. Tim?
Thank you, Mayor. Just wanted to remind everyone that the Commonwealth of Massachusetts has made $50.8 million in grants available, as the mayor indicated. The purpose of the grants are to support small businesses, micro-enterprises, and their employees and families and the communities at large. Massachusetts Growth Capital Corporation is administering the funds. The grant funding is intended to help businesses adversely impacted by the pandemic. Preference is being given to small businesses whose owners are women, minorities, veterans, members of other underrepresented groups who are focused on serving gateway cities in Massachusetts, and those most negatively impacted by the COVID-19 pandemic. Preference will also be given to applicants that have not been able to receive or have gotten any aid from other federal or state programs related to COVID-19. Applications are due in on the 12th of November at noon. If you are a business and have an economic need, please contact Massachusetts Growth Capital Corporation, area code 617-523-6262, or go onto their website, empoweringsmallbusiness.org, to download the application. If you need technical assistance in filling out the application, please contact the Office of Economic Development. We can refer you to a technical service provider. Update on the rent, mortgage, and utility program. As the mayor indicated, we have roughly $890,000 that's been dispersed to 311 families. Our original allocation to this program was $2 million, so the funding is going very quickly as the moratorium on foreclosures and evictions has been lifted. The homeless outreach and healthcare providers such as Mercy Medical Center have been hiring up in response to the homelessness effort that we advanced funding into last month, and we are anticipating that those programs will be fully staffed within the next couple of weeks and that we will be activating that programming. Our work continues with Common Capital on small business assistance. Common Capital continues to do intake and outreach to small businesses that are interested in getting city support. And consistent with the governor's economic focus on workforce development and training, the city will release this week a significant tech training grant RFP. Thank you, Mayor.
Thank you, Director Sheehan. We just we met with the new executive director also of Tech Foundry, and we look forward very much with working with him, and this aligns with the business community on that. You were given briefly the update from Solicitor Ed Pakula and HR Labor Director Bill Mahoney earlier, and I gave you the financial update from my CAFO, TJ Plant. So with that, we will open it up to any questions or comments that the media might. Audrey, go ahead. Yeah, go vote. You know, and I'm very proud of Election Commissioner Gladys Iola and her team and the whole city staff. They did a wonderful job on early voting here at City Hall and the Claudio Concepcion Greenleaf Community Center. The poll areas will be safe and sound. I'm old school. I'll be going to my polling area early tomorrow morning on it. And again, they will be secure. There's always a police officer there, and Solicitor Pakula will head up the division that works every year. DOJ and the ACLU are doing this across the country on it, so it will be safe and sound. Be prepared at certain high volume times. You might have to wait a little bit, but just be prepared, and we welcome you. And I tell people all the time, you got to get out. You want to be heard, get out there and vote. That's what Veterans Day is coming up next week. And even though we can't have our great parade, we will be honoring our veterans. But those veterans and their families, many have made the ultimate sacrifice to give us the ability for democracy and to give us the ability to live lives the way we want to, whether good or bad. And how do you do that? With a vote. So please, it'll be safe and sound. And if you haven't voted already, we had a very brisk pace on early voting. In the drop box, everything went well. Your polling locations will be open 7 a.m. To 8 p.m. and we'll be ready to rock and roll as we did during the primary, which was some very big contests, and we had strong voting going on then. We'll have strong voting going on now with a presidential election. But yeah, get out there and vote. Yep. That's for us to know. That's for us to know. And again, that's if anything should rise. One thing, myself, my administrator, we'll always be prepared, as you've seen. So if Commissioner Clapprood, they've had their strategic meetings. We've had our strategic meetings. Deputy Cochran is here. Extra details will be out and about. If needed, I would hope people would exercise their right to vote in a peaceful manner. If needed, as I have done before, if the National Guard is needed, or the State Police is needed, or Sheriff Nick Cochie's crew is needed, they will be on beck and call, if needed. If needed. I'm very hopeful that once again the residents of the city of Springfield, a lot of times when these things do occur, it's usually outside agitation that occurs, but we were looking forward to a peaceful voting aspects, but we're going to make sure that all my residents, no matter what creed, color, or background, and business community, are protected. And I've done it before. I will do it again if necessary. Thank you.
Mayor,
Yep.
just to follow on that, are there any specific credible threats that the city is aware of?
No comment. No comment. No comment. Anything else? Yes, Mike.
Just in case the COVID keeps surging, is there any plan for what would happen if we needed to shut down?
We'll await to see what Governor Baker might have as an edict, but again, with Dr. Kerouac, who served on Governor Baker and Lieutenant Governor Polito's review board, you pinpoint the areas. And again, we're going to balance our decisions, Mike, on public health, sciences, and medicine, but I'm also trying to balance keeping businesses going, too. So I think Dr. Kerouac backs that up, being a very highly respected medical professional, saying, we're not looking at a complete lockdown here. We're going to continue to stress the message and educate what residents and businesses need to do, but that would be a last gasp type thing. We're staying in phase 3 right now, step 1. And, but you have to look at it, where specific areas where it's coming from. You understand? I mean, Helen's been out there at the box stores, the stores, the restaurants. The uptick seems to be identified in households, homes. So we're going to continue to keep pressing. I can't thank enough Patrick Leonardo, AMR. They've been great, and Governor Baker, Lieutenant Governor Polito, Secretary Sutters, and Helen and I were always, I don't want to say screaming at times, but always saying we want more testing, more testing, more testing. And we've been able to get that, and we still want more. And Helen is also being much more aggressive, picking up the pace. She's going to expand expansion of the contact tracing, which is key on it. But I think the big thing here, the age demographic has shifted tremendously compared to March and April and May and June, where it was older individuals getting this virus. She told you the percentages. And our young people, you think you're invincible. You're not. You're not. Huge percentages, 30 and under, 20 and under. So you're not invincible. We need you to follow these guidelines. You might say, I feel fine. You might be passing it along to another loved one, whether young or old. So think of that, and think of those individuals on it. So we'll see. I think even, again, I can't speak for the governor, but I think if anything came, I don't know if it would be across the board. We have designated areas, the green, which we were at one time for a mid-sized city in America. It was a tremendous accomplishment. We want to get there again. Yellow, red. So I think you'd have to pinpoint, you identify those areas, you isolate those areas, and then if you have to take a step back, you do that with those certain areas. Again, I want to balance public health, but I also want to balance keeping livelihood and jobs going. What else? Paul?
I've got a question about the machine.
R2T2? Yeah, Pat Sullivan. Want to turn it on, Pat?
Sure. I guess it causes a little bit of noise.
We'll just turn it on for a second. What do you need to do?
Takes a minute to get going.
What are these costs?
We are working with procurement, but they're roughly about $2,000.
And so how many do you have to buy for the school?
We are going to be purchasing 300 for the schools and about 160 for municipal government.
And there's going to be some additional expense in installing these, correct? You're going to have to do some electrical upgrades.
Yeah, and those 4 school buildings will be spending an additional $500,000 for the increase in electricity that they will take.
$500,000 per school?
No, just total. Across the 4 buildings.
Already, as a matter of fact, just to Bob Kirscher said, Pat's team, Pat's crew, they've already been doing work already in many of our schools and our buildings already.
So we've already ordered MERV 13. For the other 51 school buildings, we have the MERV 13 filters already installed. We are ordering enough to get through the next year, if you will. We've put MERV 13 filters in our municipal buildings as well. So we're trying to stay ahead of the curve.
So you're getting to a position where you feel comfortable that you could reopen the buildings once these are put in?
Once these are installed in those 4 buildings, I think we're providing the best possible conditions that we can. And again, we're meeting that Ashrae standard, which we think is really the recommended way to go. Putting a box fan with a filter was the DESI solution. Our solution is this.
But that doesn't necessarily mean, again, Bob Kirshner said it too, and Superintendent Ward, if and when, okay, we're going to base it on where we're standing on public health, but still masks are going to have to be worn, the hand washing, the social distancing. Also, we're going above and beyond DESI. If and when bus transportation comes into play, we might be looking at temperature checks prior to get on the bus. So what we're going to do is we made the presentation. It was a good marathon meeting we had Thursday night. So it was a public presentation on everything we're doing, if and when it's the appropriate time to have our kids and staff come back to the school, that we go higher above those standards. In turn, we will have the town hall meeting November 10th, and then we'll do a vote November 12th. As we said we would do, we're starting remote, and then we said we would relook at if there's a possibility of some type of going back with a hybrid or anything. If not, then we'll stay status quo. But we want to be prepared. We want to hit the ground running with our buildings, school buildings, and our municipal buildings.
And did I hear you correctly on Thursday night? You said that you were looking to potentially pay for these with CARES Act money?
What we're doing as far as anything that's COVID-19, whether CARES Act, along those lines, as I've done with other natural and man-made disasters, we spend what we have to spend to make sure that our residents and business community is safe and sound, and then we go after everything on reimbursement, CARES Act, COVID-19 money, FEMA money, and that's what TJ Plant and his team does a great job with my cabinet heads tracking all this. I gave you a figure. Some of that figure is down probably about $4 million or so because we've been able to pawn off on existing grants. A second round will be going in on the state CARES Act. We're very hopeful on the federal level that another stimulus, which is much needed, comes across from the federal level. I know that Congressman Neal, Chairman Neal Ritchie, is fighting very, very hard on that. And I'm hoping the powers that be on the federal level can, be bipartisan. This is, this is working together for the good of the people and business community. So let's do a little bit more of this instead of this on it. So, but I was very happy. Superintendent Warwick stated it. Pat Sullivan stated, Bob, our industrial hygienist, Kirshner, indicated he didn't know what he was going to walk into, as he's done with many systems in New England. He was pleasantly surprised. Wow, Springfield is on top of its game. That's a testament to Pat Sullivan and his John Kerrigan and team. So 51 buildings would be able to go. There's no air quality issue. We're able to meet the higher standards we want. We have 4 other buildings. A couple of those buildings in question, I'm building new schools. They'll be gone. Homer will be gone. Brightwood will be gone. Lincoln, they'll be gone. Brightwood, Lincoln will come online next year. Homer and DeBerry construction will start as early as next year. So, so we just want to be prepared. Be prepared. But that'll be a decision based with Superintendent Warwick, the school committee, Commissioner Helen Carlton Harris, on how we, either way, our children are still going to get educated, whether it's remote, whether it's hybrid, or whether it's all in. But we want to be prepared that we're ready to go. Any other questions, John? Yeah?
Question for Helen, actually.
Sure. Mr. Carlton?
Seeing the data. So the state released its data last week about where it was seeing some clusters and the emphasis was on households. I'm curious if in your office's contact tracing, if you're getting any sense of where it's coming into the household. My assumption is basically, if I understand it correctly, that if the person who got it was only like one other person, it wouldn't count as a cluster somewhere else. So the cluster can only be identified in the household itself. Are you seeing any source of where the virus is actually getting into a household and thus creating a cluster there? That wasn't necessarily apparent.
So the contact tracing that we have identified is not tracing it back to restaurants, businesses, convenience stores, or other facilities. So we ask individuals to report where they have been, who they have been around, and it is not being traced back to those businesses. Your question around what's the source? Somehow the virus is getting into the household, and what is that source? We have not identified it as exterior to the family household clusters.
So does that, do you think that kind of lends itself to the suggestion that it was probably some interaction that one member of this household had, probably someone unmasked another person outside of the household? Is that like a guesstimate at this point?
So when I look at the data, I can tell you that there are several households on a street, for example. So we could have one positive. That individual could have had a small gathering, and then others became positive at that gathering, went back to their households, and infected those individuals who were in their household. So again, small and large gatherings, and then coming back into the household. This virus is so highly contagious that just one individual having COVID-19 and getting it 24 to 48 hours before symptoms when they're shedding the virus and then infecting other people during that period is potentially the source of what we're seeing in households.
And just within one more final point, so when we look at where, if you look at your map, your zip codes, where these things are, you really are you seeing truly a lot of just how that household, like it just goes from like 1 to 5 or whatever it might be? Is that like a big driver of the data that you're seeing in the city as well?
We are seeing multiple households on one street, multiple individuals in perhaps a multi-story housing, not necessarily a large housing complex, 2, 3 family complexes. And again, if you look at 01108 and 01109, those are I'm sorry, 01118 and 01119, those are places where we didn't see a lot of infection in the past, and we are starting to see an uptick in those neighborhoods as well, where there were 0 infections. And again, we're looking at single-family houses, individuals who may have gone to another gathering where they came back to their household and then infected individuals within that household. So multiple infections in multiple areas are traced back to gatherings that happened with more than 1 people on a street or in a household.
Based on the trend citywide, nationwide, what strategies that Springfield has employed have you found to be most successful, and are there any new strategies, thoughts coming forward with comment?
The most effective strategies are working directly with our residents, and so working through those trusted individuals in neighborhoods where we're getting individuals out, information out is one strategy that we believe is going to have an impact. Also working specifically, setting up tables in neighborhoods where individuals can gather and get face coverings and get hand sanitizers. So we think individual strategies in individual neighborhoods, particularly where there are high infection rates, will potentially work. However, again, we are seeing an uptick, so it is not going down, and so we have to get more aggressive in our information campaigns. That's why you'll see the neighborhood ambassadors and the PSAs and us directly talking to our residents and saying, we need you to practice the interventions that we continue to talk to you about.
Thank you, Commissioner. Any other questions or comments? Okay, hearing none. Again, I really want to thank the media, the TV media, radio media, print media, for getting this information out. I want to thank my cabinet heads, all the way down to rank and file. Again, tested and true. I appreciate their efforts through natural and man-made disasters. Please heed this advice, and especially to our younger people. You are seeing the percentages on a younger age demographic explode. I mean, we're not talking about 50 or under anymore. We're talking about 30, 20 and under. So you're not invincible. You need to wear those masks. You need to curtail where you're going, who you're with. That circle needs to be small now. And if again you think, I feel good, there's nothing wrong with me, you could be harming a loved one. You could be harming a loved one. So you need to plan now. The holidays are coming up. We will defeat this COVID-19. And then we'll be able to go back to a normalcy. We'll be able to go back to our traditions and to our holidays. But until we have that full-fledged vaccine that is ready to go, you need to follow and heed the advice on public health, medicine, and science. Extremely, extremely important. We want to start to see the numbers go down. Right now, they're escalating very, very quickly. So to each and every one of you, thank you for your continued patience, understanding, and working with us. I know you're fatigued, we all are. But as we come across the Veterans Day, remember what those veterans, what they went through, what they're still going through, the ultimate sacrifices they paid. So this is not that much of a sacrifice to lead the lives you want to lead. We did it before. I know that we can do it again. So wear your mask. Have a mask on you all the time. Even if you're with, make sure you have it. Can you take up, have that mask. Wash your hands. Social or physical distance 6 foot away. If you don't feel good, stay home. If there's any question, asymptomatic, you can get tested. AMR, Patrick Leonardo, Director of Operations, you can get tested. There's no issue with that. Helen's crew calls on contact tracing. Please answer that phone. Nobody's there to get in your business. We're getting in the business of making sure you and your family are okay. And we're going to pick up the pace on that. So let's end on a good note. Go out, have a good day, good health, and God bless. Thank you very much.